is Juan Bertholle, a fourth-year resident at Vallebron Hospital in Barcelona, and I'm very glad to participate in the 22nd European Congress of Urology. I'm going to talk about kidney transplantation in patients of 80 or more years, a retrospective multicenter study. I have no potential of interest to report. Renal transplantation provides greater survival compared to dialysis in patients with kidney disease. However, the results in older recipients are uncertain. The objective of our study was to describe the short medium-term results of patients aged 80 or more years who have received a renal transplant in Catalonia and compare them to renal transplantation between 75 to 79 years and also with patients of 75 or more years on the waiting list on hemodialysis. So, what we have done is a multi-center retrospective observational study with data from the registry of renal patients of Catalonia and compare the three groups of patients as we have said before. The group 1, there's the patients of 80 or more years with a renal transplant. Group 2, renal transplant in patients of 75 to 79 years. And the group 3, there's patients on the waiting list of 75 or more years on hemodialysis. And we have made a descriptive statistics and univariate survival analysis. So, as we see in this table, of the patients of 8 or more years, this is 56.5% were male, a third part had diabetes, and almost 2/3 parts any cardiovascular disease. There were no statistical significance differences between cold ischemia time, nor donor age between group 1 and group 2. However, it has to be mentioned that recipients of more than 80 years required more frequently any session of hemodialysis post-renal transplant, but with no significant differences in the rate of primary renal function at 6 months post-renal transplant. The survival of the recipient of renal transplant 8 or more years was 70% at 3 years, and when we analyzed the death tensor graft survival at 5 years was approximately 80%, without significant differences when we compared it to group 2. Although there were no significant differences between three groups regarding survival, the oldest one were slightly worse during the first 15 months after transplantation when we compared to group of 75 to 79 years with a renal transplant. Furthermore, they had more deaths during the first 20 months compared to waiting list group. But as we see, after these circle marks, this trend was later reversed. To sum up, our conclusions would be that recipients of renal transplant of 8 or more years had similar post-transplant survival outcomes compared to recipients of 75 to 79 years and waiting list recipients. So we should inform our octogenarian patients that there is no greater survival, but better results in quality of life. It's necessary to improve the selection criteria for these patients and potential kidney to avoid an early increase in mortality and graft losses. That's all. Thank you for your attention.